Hello everyone, my name is Ernest Obiena and this is Health Vault, where we jump into the fundamental topics about health and wellness. Today, I am joined by our doctors.
Hello everyone, I am Dr. Brian Nelson Ong, an adult pulmonologist and sleep medicine specialist practicing at Our Lady of Lourdes Hospital.
And I'm Dr. Dominic Perez, an adult neurologist and a sleep medicine specialist at Our Lady of Lourdes Hospital.
Okay, let's talk about awakening the truth behind sleep apnea.
So sleep apnea, as the name implies, is a stoppage in the breathing during sleep. Now, usually would manifest with snoring. There'd also have patients would also complain of daytime sleepiness, tiredness, easy fatigability, and usually a bit of interrupted sleep or shallow sleep.
Our anatomy is made up in such a way that it is patent when we're awake. But pag natutulog tayo, these muscles relax. So, if yung upper airway natin is baseline, masikip na siya. And when we sleep, these muscles relax. There's a partial or complete collapse of the airway. And imagine if that airway is narrow, the airflow cannot pass. And that causes also your body to wake you up or lighten your sleep. And this happens repeatedly throughout the night.
I mean, for us athletes, it's quite important, truly as part of our recovery. We try to be as religious as we can, but it's a good thing of knowing what exactly is sleep apnea. Maybe you guys can share what you guys do in the sleep laboratory exactly on how to treat or cure or diagnose sleep apnea.
So, sleep apnea needs a confirmatory. It has to be done in the sleep laboratory. So, there are electrodes placed on the patient. We put electrodes on the head to check for the sleep staging. And then there are sensors for the eye movements, chin movements, and the leg movements. We also have nasal sensors and belts around the chest and the abdomen. So, that is to check your breathing. So we usually do that for the first part of the night if it's combined sleep study. And then thereafter, if it's confirmed that you have moderate to severe sleep apnea, we proceed with the therapeutic trial of the CPAP. So we attach a CPAP machine to the patient where we get the pressure that will be used to set the machine later on. So yung first line treatment talaga for obstructive sleep apnea is the use of CPAP machines. So if our patients usually ask us, is this for life? Yes, unless there's a major alteration in your anatomy. So surgery is an alternative treatment, but that is if you have an indication na operahan ka. So like malaki yung tonsils mo, no? Your adenoids at the back of your nose, those are some of the indications. Some would also apply oral appliances, but it depends also if your anatomy needs it. So that can improve but may not cure exactly sleep apnea. But with CPAP, it's 100% effective as long as it is set according to the pressure requirement and you use it on a nightly basis.
Nikki has very well explained. It's a overnight procedure that we do here in the laboratory for the usual indications of discovering sleep apnea or other problems like narcolepsy. There's also has a role in periodic limb movements, although these are much rarer. Of course, the most common would be the sleep apnea pa din. There are different kinds of sleep apnea as well. I mean, usually we encounter the obstructive sleep apnea. There's also the phenomenon of the central sleep apnea, wherein there is no effort in the because in obstructive sleep apnea, you would detect an effort to try to breathe against a closed airway. But central sleep apnea, wherein it's usually associated with neurologic conditions, or there might be a underlying pulmonary or cardiac condition, or even renal conditions, that would lead the central nervous system or the respiratory center to stop breathing on its own due to certain imbalances in the hormonal milieu. And so yeah, so we can use the sleep study to discover these as well. It gives a certain pressure lang depending on the requirement of the patient. May mga ibang pasyente kasi mas masikip, so you need higher pressure. But sometimes that might not be enough, so you need to switch to a higher level ventilation, like say a BiPAP or a bi-level positive airway pressure device, wherein you have a separate pressure for the inhale and the exhalation. Kasi may mga ibang pasyente, yung continuous pressure pag masyadong mataas, hindi na kaya. So you need to switch it to something that may exhale and may inhale para makahinga sila ng mabuti.
So the nature of my sports, unfortunately, is skipping about town. Like sometimes we're in 3 different time zones in a week. So for me, I try to adapt as much as possible, or if it's gonna be a round trip kind of thing, I actually try not to move my sleep pattern. So instead of adapting, I just stick to it. If I'm staying for a day or 2, let's say in Asia, and I'm gonna be back in Europe anyway, I'd rather not move that sleeping pattern and try to get as much recovery and rest still in between those trips.
Right. Well, basically, your approach is good for the short stays, no? Kasi it's kind of hard to disrupt the basic body rhythms. But in cases wherein you have to move across time zones and whatnot, there's of course the phenomenon of jet lag. Wherein if there is a prolonged stay, or gusto mag-maximize ng mga stay nila, sometimes there would be you could do some interventions wherein to either habulin mo yung time, or you could depende kasi sa movement mo across time zones eh.
When patients consult with us in preparation for their travel, we ask them where exactly they're going, kasi it matters if the flight is westward or eastward. Yeah. So mas mahirap kapag east going to the east. So what we tell our patients is, as soon as you land dun sa pupuntahan mo, you stick to their time zone if you're planning to stay there for long. As Dr. Brian said, pag shorter stay, you need not to conform to their time zone kasi babalik ka din. Mas magugulo yung body clock mo kung papalitan mo, pagpunta mo doon, tapos babalik ka ng Philippines. So yeah. Also, yung sleep within the flight, that matters also. Para kung dadating ka, for example, sa place na pupuntahan mo ng umaga, pwede kang matulog sa flight so that you can start the day dun sa pupuntahan mo. But if you're going to a place na gabi na yung arrival mo, you try not to sleep in flight para pagdating mo dun sa place na yun, tulog ka.
I see.
Yes.
That's great tips. Thank you.
Thank you for joining us for this session. We talked briefly with GJ about basics of obstructive sleep apnea and also the interventions that we can do, and also touch briefly about our sleep laboratory and also problems with jet lag, especially for athletes like him who move across time zones. So yes, I'd like to, of course, take this opportunity to announce that we do have the functioning sleep laboratory here. We do the type 1 or the gold standard polysomnogram, both the diagnostic and the therapeutic, and we can also do the split night, as Dr. Nikki has mentioned earlier, wherein you do a diagnostic part first, and if the patient is really have moderate to severe sleep apnea, you could do a therapeutic as well. Also like to announce that our sleep laboratory can also avail of PhilHealth actually. Of course, it is prudent, of course, to consult with a sleep medicine specialist prior for either the admitting order or to determine what test the patient would need. It's not just the diagnostic or the therapeutic or the split night that would require a bit more subspecialty input in order to find out what needs to be done.
Also the preparation. So very important to prepare the patient before the sleep study, and of course explain the results thereafter. So a consult is also important.
And that it is for today's discussion. Don't forget to like, share, and follow Lourdes Hospital on all their socials for their latest updates and posts. And if you have any questions about your health, feel free to leave us a comment down below. Thank you, Doc Brian and Doc Nikki, and for everyone joining this episode of Health Vault.